Hello everyone and welcome to Module 4, Assist. This is the last module in our naloxone administration training. Congratulations. Step 1 of Assist is the recovery position.
And then the hand which is nearest to you, you would put at a 90-degree angle. The hand which is furthest away, you use the back of their hand on their face and you hold that there whilst you would bring their knee up and you use their knee as a lever to turn them over. And then you would pop her leg just like that. And now I know that she's in a safe position.
Okay, so there are several steps to recovery position. Truly, this just makes it more ergodynamic and easier for you to turn the person over. What you need to remember is get the person on their side and make sure their airway is open and their mouth is at an angle where if they vomit or have an excess of secretions, we will be using gravity as our friend, and that vomit or secretions will go on the ground instead of in the back of their throat, potentially choking them or causing aspiration, which is where it gets in their lungs, which could potentially cause pneumonia. So, step 1, lay the person on their back. That's how we're going to get started. Place the arm nearest to you. Bend it at a right degree angle with the elbow bent and the palm up. The arm farther away from you, we're going to bring across their chest and place the back of the hand on that cheek. This provides a little bit of support when we're rolling them over, but it also brings some of that upper body weight over prior to us trying to turn them to their side. On the leg that's farthest from you, pull their knee up in a bent position to where their foot is flat on the ground. Now, using that knee and holding their head, you want to roll them toward you onto their side. Tilt their head back just slightly and lift their chin to ensure an open airway. Like I said, the goal of recovery position is to prevent aspiration and choking from secretions or vomit entering the airway. If you forget a step or two while you're performing this on a person, the point is to get them on their side with the ability to use gravity as our friend so vomit doesn't get into their lungs. As you can see in this picture here, her head is slightly tilted down. He's making sure her airway is open and that vomit would go down. Assist. Stay and relay information. In previous modules, we have discussed Aaron's Law. Many of the steps that we go through in this training are pertinent to Aaron's Law. We call 911. We administer the naloxone. We stay and we relay information by being cooperative at the scene. So what information might they be looking for? Approximately how long the overdose occurred. What drug they took, if you know. And how many doses of naloxone you have administered. Let's do a quick knowledge check. These are going to be true or false. Recovery position is to assist in preventing aspiration. True. Narcan or naloxone is a safe medication. True. It is important to remain calm. True. These are some local inpatient resources to the state of Indiana. Not everyone may need an inpatient scenario. However, it is important to know options because maybe they are ready for that. After an overdose occurrence, it may be a wake-up call. Other local resources include medication-assisted treatment, or MATs. These are locations that have a provider who can prescribe Suboxone or Methadone in order to help reduce opioid use. Overdose Lifeline is also a magnificent resource. This website that I have linked is for the naloxone distribution locations here in Indiana. Oftentimes, firehouses will have naloxone distribution. Now we're going to take a little test together. When assessing if a person can respond, I will say this while using my knuckles to rub the chest bone. All of the above. Naloxone, Narcan, cops. Hey man, are you okay? Blank can increase the risk of an opioid overdose, using alone, mixing drugs, or the first dose after an extended period of time without use. All of the above. Environmental signs and symptoms of an opioid overdose include needles, spoons, tourniquets, or all of them. All of them. True or false? Naloxone is a safe medication. True. For all ages, young and old. I think that's one thing we may forget, is that we may have to use naloxone on someone that is truly prescribed an opioid medication. Our elderly population may not remember as well as some of the rest of us and take too many of their opioid medications because they've forgotten that they already took it that day. Blank can decrease the risk of an opioid overdose. Knowing the source, using less after an abstinence, or education on overdose prevention. All of the above. If that's what you guessed, you're correct. How often can naloxone be administered if a person is not responding to the previous dose, or if the previous dose starts to wear off? 2 to 5 minutes. Symptoms of an opioid overdose include decreased alertness, pinpoint pupils, breathing that is slowed or stopped. All of the above. During rescue breathing, you give 1 breath every 5 to 6 seconds. Recovery position is important to prevent aspiration choking or both. Both. True or false? You must call 911 and stay with the person until EMS or law enforcement arrives, per Aaron's Law. This is true. Thank you for completing Module 4. Lecture.